You are welcome once again to another episode of your favorite program, Blood Talks, the science of what flows through you. Now, last week, we were discussing a very important true life story of a couple whose baby came down with sickle cell disease, and the husband was supposed to be hemoglobin A and the wife AS. After a lot of controversy, we were able to resolve that the baby actually belonged to the husband. Now, in today's episode, we would like to examine this issue of thalassemia. Now, I'm sure you must have heard about it, and if you have not heard about it, it exists. It's not a myth. I'll be discussing more about sickle cell in my next video. And in that video, I would like to examine why sickle cell patients present differently one from another. Why some have more frequent crises, some have more prolonged periods on intervals without crisis. We will discuss the reason why in our next video. But for now, let's look at this thalassemia that we all think does not exist. Now, I must tell you that researchers have found, including researchers from Ibadan, Rivers, my good friends, Kotila, Omoti, even myself, a group of my researchers have found that the prevalence of carriers of thalassemia beta in Nigeria is as high as 26%. Wait, I will explain to you. Now, when I say thalassemia is a disease, a genetic disease that arises as a result of a missing part of your hemoglobin. What is hemoglobin? Now, in the human red cell, that red cell is the one that carries oxygen from your lungs to the rest part of your body. Inside the red cell, to do this, is what is called the hemoglobin. And hemoglobin is made up of two parts, iron and protein. Now, see that protein part of it, okay, is where the problem usually comes from. That protein part has two types of proteins that join together to form the hemoglobin. The alpha and the beta chain. Now, the beta chain is inherited from both father and mother. Now, you must have seen that when a baby is still in his mother's womb, there are two types of hemoglobin that is important. When the baby is in mother's womb, the type of hemoglobin he needs is called the fetal hemoglobin. That is the type of hemoglobin that is able to carry the type of oxygen that is required when your baby is inside the mother's womb, because that place is a bit different from the outside world. Now, when the baby is born, that fetal hemoglobin begins to give way gradually for the adult type of hemoglobin. Now, after 6 months, the adult type of hemoglobin replaces the fetal hemoglobin. It is this adult part of hemoglobin that has alpha and beta chain. Now, the beta chain is, as I said, makes up that hemoglobin that has alpha and beta chain is now called the hemoglobin A, the adult type of hemoglobin. Now, some of you call it hemoglobin AA, as in genotype AA. Yes, you are right, because the A is from both mother and child. Each person has two of it, so you call it AA. A from my father, A from mother. Now, if one of the parents have their beta chain defective, it's a gene mutation that does not allow beta chain to be formed. That means that your parent will have only one beta chain instead of two. Because it has only one beta chain, it will still function normally. He will not have problem, will not have disease. But when he's about to mate with his wife, he will either donate one good one to you, or he will donate one abnormal one again to you. Now, can you imagine if both parents had two abnormal beta chain? So, if one parent pass an abnormal A and the second parent pass an abnormal A, you can see that's a frank beta thalassemia. And those people will present as if they are sickler. They have the same characteristic like a sickler. Okay? But however, if it's only one bad beta chain that is in the child, the child will be normal. But however, that child can pass that chain to his own child. So that is how we explain the reason why if you are hemoglobin A and you marry an AS, there's still likelihood that you can still give birth to a sickler. However, the best way to actually find out whether you have this thalassemia. Now, my friends and researchers have done a lot of work in Nigeria, and I will tell you that Omoti, Kotila, and my humble self and a few of our other research have found that the prevalence of beta thalassemia trait among Nigerians, it could be as high as 26%. Now, can you imagine what 26% of 200 million Nigerians are? Just do the maths. You see that there are a lot of potential people who think they are free, but if they marry an AS and they happen to be beta thalassemia trait, their child can still come down with sickle cell. Okay? How will you know? That is the question you want to ask. But I can tell you that you can do a screening test by doing what they call the hemoglobin quantification test. Rather than going to the lab and do genotype test, do hemoglobin quantification test. That test will show you the pattern of your hemoglobin that you have. And then you can begin to automatically see whether you are a beta thalassemia trait person. Okay? Now, I will encourage couple who are about to get wedded, especially if your partner is AS and you are AA, please do hemoglobin quantification test to be sure that your AA is not actually an AO. Because you think you have escaped, you may just be playing into the hands of sickle cell disease in your child. This is Professor Vincent on our favorite program, Blood Talks, the science of what flows through you. If you have questions, put them in the message box. I will reply you. If you have challenges with your health, hematological related problems, put it in the chat box. I'll be glad to help. Thank you very much. So stay tuned for the next episode. We'll be talking about sickle cell disease. We'll go into details. If you have questions you want to ask before the next video, you can send it to me. I will prepare to answer them in the next video. Thank you so much. Thanks for watching.